Hello, my name is Linda Albert, and I'm the coordinator of the Wisconsin Lawyer Assistance Program. I'm here today with Deb Smith from the Wisconsin State Public Defender's Office, and we're talking about the results from a research study on the impact of secondary trauma on attorneys. So Deb, your organization joined with the WISLAP program and with Dr. Andrew Levin to study the impact of secondary trauma on attorneys. Can you explain what secondary trauma is and how you believe it affects lawyers?
Sure. As you know, human beings are more or less hardwired to empathize with the physical and emotional pain of other people. So when your job involves a constant diet of stories and reports of people committing acts of violence against others, seeing photos of violence, listening to client stories of violence, your brain takes in that pain, and it can affect your psychology in a way that's very similar to the people who are actually being traumatized by the violence. It can lead lawyers to be more prone to depression and anxiety, to post-traumatic stress disorder, and to impairments in both professional and social functioning.
So how did your organization get interested in doing this research and become a part of this project?
Well, I attended a presentation on this subject that was given to our senior management, and the information in that presentation, especially the stuff on brain science that documents this phenomenon, really resonated profoundly with me and my experience in 30 years of being with the public defender. So I encouraged our agency to participate in the study so we could get some data and exactly how this may be affecting our staff and what we could do to help.
Mm-hmm. So what have you learned?
Well, basically we've learned that there's nothing wrong with our staff. You would have to be a narcissist or a sociopath not to have this sort of thing affect you, but they are at risk because of the type of work they do. And the study showed that our staff is at significant risk for depression and post-traumatic stress disorder and impairment of functioning, and we need to help them address the effects of the work that we're asking them to do.
So what is the organization doing in order to respond to the results of the study?
Well, part of what we did actually as a part of the study was we had 10 regional training days which helped to make staff aware of this issue and some things they could do to help themselves. But also based on what we've learned through the study, our agency is now signed on to the state's Employee Assistance Program contract, which will provide our staff with a wide range of services to help them when things get particularly stressful.
That sounds great. So what advice do you have for attorneys specifically in order to help them mitigate the impact of the nature of this work?
Well, you know, many lawyers like to think that they know how to keep a professional distance, that they're not affected by the work they do, that they can handle it, and that anyone who can't should find a new line of work. And they believe that asking for help is a sign of weakness. And I guess my advice to lawyers is don't kid yourself, don't think you're immune, be aware of how the work affects you, and if you think it's not affecting you, ask your colleagues or ask your family what they think. Take some time to take care of yourself, stay connected to friends and family who are there to support you.
Mm-hmm. Well, the project continues, and I know that in the December issue of the Wisconsin Lawyer, there's going to be another article about the results of the research project. The Wisconsin Lawyer Assistance Program continues to be a resource for all legal professionals who may be struggling with any type of issue that can affect their impact to practice. And thank you for joining us.